How's it going, guys? So this is Dr. Suh as Specific Chiropractic, providing Gonstead Chiropractic in Manhattan, New York City. I got a guest over here. Fill us in. What can we do to help you?
I need help with my jaws.
Okay, let's speak a little louder. Can you say again?
Oh, I need help with my jaws.
What's going on with the jaw?
I clench my teeth at night.
You clench
I clench my teeth at night.
clench your teeth at night.
Mm-hmm.
So that's what we call Bruxism, right? That's where the teeth are being clenched. All right, what are you doing for that?
Right now, nothing.
Nothing. I understand you're the consultation. Are you wearing a night guard with that?
Right now, no.
No.
No, right now, no, because they will have to do some implant. So that's why I cannot wear right now.
Gotcha. Can you do me a favor? Can you take your mask off? Okay, let's show to the viewers over here. Go ahead, open your mouth and close. No, relax your hands, please. Okay, go ahead, open, close, open, close. So we already could see as well that her jaw, it's also moving as well. So you definitely got some TMJ issues going on in there. So let's take a closer look, see what's going on, why you got the TMJ issues, but more importantly, what's causing the bruxism, which is either you're grinding your teeth at night or your muscles being clenched really tight. And that's what makes things difficult for you to talk and chew on hard foods as well, right? Let's roll. Okay, we'll start off with instrumentation. And the purpose of this device is looking for any signs of inflammation. So when the tissue gets damaged, there's an inflammatory process that signals to the body, says, hey, you gotta go pay attention to this area. See what's going on and start repairing whatever's going on in that region. So one of those signs and indicators is there's gonna be swelling. And that's what we're seeing over here. And some puffiness over here as well. And additionally, there's gonna be some muscle tightness, spasms. And also because there's increased vascular supply, as in other words, more blood is coming into the area, it's trying to introduce more white blood cells. As a result, the byproduct is going to be heat. And that's what this device is picking up. So we got some abnormal heat readings on this level here, another at this level here. And I definitely want to take a look. See over here, there's some muscle spasms here, more swelling on the left-hand side over here. So we're also going to, I would not be surprised. Yeah, you got something right there. Okay. Right there. All right, now let's take a look, see what's going on, why we know the swelling over here. Let's check the foundation. Okay, that's pretty decent. Moving just fine. Okay, number 2, slightly fixated, but not too bad. How's that fella right there?
Okay.
You sure about that?
No.
There you go. Yeah. And number 5, that's in trouble there. How's that fella right there? Yeah, that's not great. Yeah, can adjust there. Okay, relax the hands. Yeah, you got quite a bit of swelling right there. Right at the spot. Yeah, this third cervical is not too. See, you feel that right there? Yeah, that's stuck. That third cervical is also in trouble. All right. So to the viewers, you may be wondering, why are we looking at the lower back, the mid back, and the neck? When your chief complaint is, I got bruxism. My teeth are clenching and it's hard to chew on hard foods. Well, the reason why is this, because it all comes down to the atlas. When I'm seeing here on the x-ray, your first bone, the atlas, the transverse process is right over here. TMJ is right over here. You're so close by right over here. So if your atlas is tilted this way, and also this way, where do you think your jaw's gonna go? It's gonna follow. So that's what we're seeing over here. Your jaw, I wanna see it smack in the middle like here, but no, it's tilted that way, all right? And it's not in proper alignment. So what happens is this. What can we do to realign your atlas from this position over here to get it over here? I have to look from the ground and going upwards. Your fifth lumbar vertebrae over here, that's in trouble. We need to address this first. Next thing I'm looking at is the sixth dorsal. If we take a closer look over here, I want to see these ribs the same, symmetrical. But then, no, what I'm seeing over here, this rib over here is higher than this one over here. Therefore, I need to address this fellow over here. Next component is this third cervical over here. I want to see it nice and straight, keep on going. But yet, it tilts over right over here. So instead of being level, it tilts this way. And a closer look on the lateral over here, right? If you take a look at the vertebrae like this, the nerves, it got to come out of this tunnel. But the third cervical, what happened is it went backwards and tilted inferiorwards like this. So as a result, it's pinching off that nerve and causing a lot of irritation. Just like over here, I want to see quite a bit of nice space over there, but nope, that one over there, it collapsed, that tunnel, resulting in that nerve being pinched off a bit. So we're going to take that pressure off that nerve, realign that structure, and we're going to find out how you're going to like that fella. Okay, come on up. Okay, go ahead, walk around.
Yeah. Is this good?
Okay, go ahead, take the mask off. Okay, go ahead, show to the viewers. Okay, open mouth, close. Tell us what's different.
No pain. I don't feel the pain. Just a little crack. A little bit.
A little crack. Were you feeling pain before?
Just a little bit.
Just a little bit. So how much improvement would you say for the pain?
In the morning it's around 8, my pain.
Well, I mean, right now.
Right now it's...
Before we adjusted you and now?
Oh, adjustment it was like a 5 something. Right now I feel like maybe 1. Not really pain.
So 5 out of 10 and then went all the way down to 1 out of 10 right now?
Yes.
For you too?
Yes.
All right, that's a good progress. Okay,
Yeah.
let's work on the rest. A little more. There's that magic. Come on up.
Oh, that's much better because this morning I came with my back in pain, especially the middle one.
Gotcha. Okay, go ahead. Take the mask off. Okay, go ahead. Open it and close. Tell us what's different now.
That sound.
What about the sound?
It's not. It's tiny. The sound.
So what was before and now?
It was bigger. It was more stronger. The sound. Every time that I open my mouth, it was. And right now it's.
Interesting, isn't it?
It is.
So that's what I'm saying. As we start to steadily take the rotation out of your atlas, things start coming down. That's working at third cervical now. Bless you. A little more.
Oh my goodness.
That was a big one.
It was.
Okay. Go ahead. Open. Yeah. What's different about this one?
Much better. Better than before.
So what was different from before we adjusted to now?
That I can move from side to side my...
Oh, you weren't able to do that before?
No.
And what else? What other changes you notice?
Well, right now, I feel good.
Okay. Go ahead, take the mask off again. Okay. No, completely off, please. No, take off completely. Okay, go ahead, open mouth and close. Close. Open. Close. Okay, so you still have a little TMJ in there. Have a seat. Go ahead, open. Close. Yeah. Open. Close. Close. Good. Open. Close. Open. Close. Open. Close. Open. Close. Open. Close. Open. Close. close. No, too fast. Open, close, open, close. Good. Open, close, open, close, open, close, open, close. Okay, stand up. Okay, go ahead. Open and close. No, a little more. Open, close. No, too fast. Open, close. There it is. Open, close, open, close. No, too fast. Open, close. There it goes. Open, close. Good. Go ahead. Open, close, open. Tell us, what's different about this one?
I guess a little bit sound here, but not here.
So no sound over here. A little bit over there.
Yes.
Yeah, that's pretty good.
Mm-hmm. Not sound here, but just a little bit here.
How much little would you say?
Tiny.
Tiny.
Uh-huh.
Hey. So here's the thing. Now the reason why you still have a little bit there is because, keep in mind, just like a patio screen door, you jump the track and it worn out the grooves. So right now, it'll take at least 3 to 6 months for your body to regrow the groove in your TMJ itself. Things you could do to help speed up that process: take vitamin C and collagen. Okay, that's what's gonna help regrow that track, the groove in there. All right, and try and still be a little careful with chewing hard foods for the moment. Okay.
Okay.
All right. Well, I hope you're glad you enjoyed your experience over here. Okay. On the next follow-up visit, let us know how your clenching of your teeth is in the morning.
Okay.
All right.
Okay, I will.
Okay. We'll see you next visit.
Okay, thank you.
Oh, you're very welcome.
Appreciate it.
You're welcome.
Okay, bye.